Today, we're diving into a really critical medical situation, severe anemia. It's a condition where the body is literally starving for oxygen. The usual fix? A blood transfusion. But what happens when that's just not an option? Well, we're going to look at this amazing therapy that can help patients breathe on borrowed time.
I want you to just imagine this for a second. It's a life or death moment. Your body's oxygen supply has plummeted, and the one thing that could save you, a blood transfusion, is completely off the table. Now, this isn't just some hypothetical question. It's a real-life dilemma doctors have to face, and it sets the stage for a truly brilliant medical solution.
All right, so to really get our heads around the solution, we first need to understand just how bad the problem is. Let's break down what's actually happening inside the body when it's in the middle of an oxygen emergency.
At its core, severe anemia is basically a massive supply chain crisis happening in your bloodstream. For whatever reason, maybe a hemorrhage or some other medical issue, the body has lost a huge number of its red blood cells. And without enough of those, the whole system is in serious trouble.
Here's a really simple way to picture it. Your red blood cells are like a fleet of delivery trucks, and their only job is to carry vital oxygen packages to all your organs. Severe anemia? That's like a sudden, catastrophic shutdown on every single highway. The deliveries just stop, and the customers, your heart, your brain, your kidneys, start to fail.
And to put some hard numbers on it, we're talking about hemoglobin levels. That's the protein in your blood that carries the oxygen. Now, in a healthy person, you're looking at a level over 12. But the research shows that once it drops below 3.6, well, that's the red line. At that point, oxygen delivery becomes so poor that the body is in extreme danger. This critical situation leads to something called oxygen debt, and it is exactly what it sounds like. Your body is racking up a debt that it has no way of repaying. It's burning through oxygen way faster than the depleted blood can possibly supply it. And if that debt gets too big, the consequence is multi-organ failure. It's that serious.
So the obvious solution seems simple, right? Just add more trucks to the road, get a blood transfusion. But sometimes there's a roadblock. And that standard, life-saving procedure just isn't possible. So why on earth would a transfusion be off the table? Well, there are a few key reasons. For some patients, it's about deeply held religious beliefs. For others, there are serious medical concerns, like the risk of infections or some pretty severe lung complications. And sometimes, in some places, the right type of blood just isn't available when you need it. So then what do? This is where things get really cool. This is where medical ingenuity shines. If you can't fix the old system, you have to find a completely new one that works on a totally different principle. Remember our delivery truck analogy? The solution we're talking about, hyperbaric oxygen therapy, or HBO₂ for short, doesn't even try to add more trucks to that jammed-up highway. Nope. Instead, it creates an entirely new parallel delivery system that just bypasses the traffic jam completely. So here's how this magic trick works. Normally, oxygen hitches a ride on hemoglobin, which is inside your red blood cells. But in a hyperbaric chamber, you're breathing pure oxygen at a much, much higher pressure. And that high pressure literally forces huge amounts of oxygen to dissolve directly into the blood plasma. That's the liquid part of your blood. The plasma itself becomes the new oxygen carrier. It totally sidesteps the need for red blood cells. It's brilliant. Now, I know this might sound a little bit like science fiction, right? But this therapy is backed by decades of really fascinating research. And the story of its discovery starts in a pretty unexpected place. So get this. Back in 1959, a scientist named Dr. Barima did what's now famously called the life without blood experiment. It sounds crazy, but his team took pigs, replaced almost all of their blood with a plasma substitute, and then put them in a high-pressure pure oxygen chamber. And the result? It was incredible. The animals survived. They lived on nothing but the oxygen dissolved in their plasma. It was the first time anyone had definitively proven that this could work. And that amazing early research has been confirmed again and again. Just look at this chart from a later study that basically did the same thing. Look at that difference. The group that got the hyperbaric oxygen therapy, 100% survival. The control group, the one that didn't get it, only half of them made it. I mean, that data is just so powerful. Of course, animal studies are one thing. What really matters is, does it work for people? And the answer is a resounding yes. Decades of published case reports and real-world clinical experience in humans have shown, without a doubt, that this therapy is a legit evidence-based treatment for severe anemia. So, how do doctors actually use this incredible therapy in a modern hospital? Well, let's take a look at its role as a bridge to life.
The clinical process is actually very logical. First, you identify a patient who has severe anemia and, for whatever reason, can't get a transfusion. Next, you check them for signs of that dangerous oxygen debt we talked about. If the signs are there, you start the therapy. Now, the key idea here is that HBO₂ acts as a bridge. It's not a permanent fix for the anemia, but it delivers that life-saving oxygen to keep the organs from shutting down. It buys precious, precious time so the body can start making its own red blood cells again. I think this quote from the source material just sums it all up perfectly. Even though it sounds so futuristic, it's actually considered low technology and it's cost competitive. It's this powerful tool that lets doctors pay down that critical oxygen debt, giving their patients a real fighting chance. Okay, let's tie this all together. So what did we learn? First, severe anemia creates a life-threatening oxygen debt. Simple as that. Second, when a transfusion is off the table, HBO₂ is an absolutely critical lifeline. How does it work? It cleverly bypasses the red blood cells, dissolving oxygen right into the blood plasma. And because of that, it works as a fantastic bridge therapy. It just buys patients time to recover. And maybe the most surprising part, it's safe and cost-effective, with a price tag similar to just a single unit of blood. And that really just leaves us with this final thought. This therapy, born from a really bold experiment over 60 years ago, is just such a testament to human creativity. It really makes you wonder, doesn't it? As our understanding of medicine grows, what other impossible medical challenges could we solve just by changing the pressure?